Mr. Deputy Speaker, the introduction of fee benchmarks is part of a larger strategy to keep healthcare costs affordable and sustainable as we prepare for an aging population in Singapore. This is a shared responsibility and requires a collective effort from all stakeholders. Individuals have to take good care of our health and make informed choices when we seek treatment. Healthcare professionals play a key role in providing quality care that's appropriate to patients' needs and charge reasonable fees for their services. Government and healthcare institutions need to continue to improve productivity and look for ways to deliver greater value for patients. Employers and insurers can help to manage increases in healthcare costs by encouraging prudent use of healthcare services by their employees and policyholders. Sir, the Singapore Medical Association, or SMA, first introduced its guidelines on fees, or GOF, in 1987. It withdrew the GOF in 2007 after it was informed by the Competition Commission of Singapore of anti-competitive concerns. There was no significant change in the average annual healthcare inflation rate in the decade preceding and following the 2007 withdrawal of SMA GOF, which were 2.4% and 2.6% respectively. Recent policy measures, such as the Pioneer Generation Package, MediShield Life subsidies, and the Community Health Assist Scheme, or CHAS, have helped to reduce the healthcare inflation rate to about 1.2% between 2013 and 2016. Over the past years, the Ministry of Health has been publishing historical transacted hospital bill sizes and operation fees for common medical procedures to enhance transparency of healthcare charges. The introduction of fee benchmarks will take this further by providing all stakeholders a useful reference. We believe this will encourage appropriate charging practices and provide useful information for patients and payors to make better informed decisions on their care options. The fee benchmarks will be set by the Ministry with advice from an independent committee that comprises stakeholders representing the medical community, providers, patients, and payors from both the private and public sector. The benchmarks will be reviewed and updated regularly with references made to historical transacted data. The fee benchmarks are not intended to restrict competition, as doctors are not prohibited from charging lower or higher fees if they wish to. The fee benchmarks serve as references for the public, including insurers and professional bodies, to assess whether the fees charged by a healthcare professional are reasonable. The Ministry will, however, continue to monitor the charging practices in the healthcare sector. Thank you.
Dr. Lim Wee Kiat.
Mr. Deputy Speaker, let me just thank SMS for the reply. I'd like to clarify with SMS regarding to this fee benchmark which Ministry is rolling out soon. Does it include the total bill and breaks down into its components into the doctor's fees, including the facility fees? Because one part of it of concerns by the public is also the facility fees that is being charged by the hospital. It's been increasing quite a fair bit recently. So that's first clarification. The second clarification is on my last question, asking about whether these benchmarks now will cause doctors who are actually charging lower fees now to up their fees instead. So we are worried about that. That could be a sort of knee-jerk reaction.
So I thank the member for his supplementary questions. Indeed, the concern about healthcare fees is not only about doctors' fees. It is the overall healthcare costs. So this will include, of course, doctors' fees, but it will also include facility fees and also other components of the overall healthcare costs that patients, that insurers, that taxpayers and government on the whole would have to pay. So we focus on doctors' fees for a start, because these were also the recommendations of the Health Insurance Task Force, which was, they made a report and recommended that fee benchmarks focus on professional fees in the first instance. And for other fees, such as hospital charges, I think Dr. Lim is aware that we currently publish the facility fee for common procedures. And if there are ways that we can present the information better to allow the members of public, to allow patients to have more information to make those comparisons, I think we'll be happy to see and receive feedback on how we can do better. And we will also continue to monitor if benchmarks for other healthcare-related services will be required in the future. So the fee benchmarks by themselves would not be a silver bullet to address healthcare costs. I mentioned in my reply that we also need collective effort from all stakeholders. Providers, institutions need to focus on improving productivity, improving appropriate care. Recently, we set up the Agency of Care Effectiveness, or ACE, and they have issued some guidances on appropriate care guides, drug guidances. And these are ways to help medical professionals, patients, and caregivers to identify what are the cost-effective treatment options. So ACE will also be looking into medical technology guidances this year to guide the selection of clinical and cost-effective medical devices. Thank you.
Associate Professor Daniel Goh.
Thank you, SMS. I'm presuming you're also answering question 13, right? Yeah. Okay. I have
For your permission to answer both questions together. I apologize for that.
no worries. I have 3 supplementary questions. The first one is, what other sources of information or expertise will the ministry be using to ensure the independence of their benchmarks other than the advisory committee? So that's the first question. The second question is, how will the committee be involving the patients? Because they're not organized into associations or any other kind of bodies. The third question will be, what will the ministry do to prevent insurers from using the benchmarks to reduce the payouts or to reject legitimate claims? Thank you.
So I thank Associate Professor Goh for his supplementary questions. I think it's important for us when we do the fee benchmarks to have representation from all stakeholders. So the professionals, the professional bodies, and of course from patients and consumers, we want to be able to reflect different perspectives as we set these benchmarks. Now, these benchmarks are meant as guidelines, as references. So when insurers refer to these benchmarks, it is not something that prevents them from treating each claim on a case-by-case basis, depending on the merits of the case. And certainly, if it's within the appropriate guidelines, insurers, I'm sure, would continue to be able to fulfill their obligations to their policyholders in accordance with the terms of their insurance products. And going back to the earlier point that Dr. Lim raised, with regards to the concern that some doctors may, as a result of this, raise their fees, I certainly hope that won't be the case, because I believe that our doctors are, the large majority of our doctors have their patients' well-being and concern at the foremost, and that's what they want to focus on. Now, of course, the benchmarks will help us to identify the small number of doctors who overcharge. And this is information for us to be able to use, for patients to use, for insurers to use, and for the authorities, including the Singapore Medical Council, to then to be able to take action and prevent this small number from raising healthcare costs for everyone else. Thank you.
Professor Goh.
Just a quick follow-up, SMS. I agree the logical representation. The question is, how do you select the patients? Because it's not really organized as a body.
So we have groups like the Consumer Association. We also have groups that can represent different stakeholders. So this is something which I think will not be possible to represent every single individual, as I'm sure Professor Goh will agree with me, but to have the input and perspective from patient groups, from consumers, certainly I think that would be something that would be taken as part of the process.